Hi, I'm Garvin. This telecast is on Detrusitol. So what is Detrusitol used for? It's used for treating the symptoms of an overactive bladder. For example, an increased need to pass urine or urinary frequency, uncontrollable urges to pass urine, which is urinary urgency, and involuntary leakage of urine or urinary incontinence. So how does it work? Detrusitol tablets and Detrusitol XL prolonged release capsules both contain the active ingredient Tolterodine tartrate, which is a type of medicine called an antimuscarinic or anticholinergic muscle relaxant. It works by relaxing the involuntary muscle that is found in the wall of the bladder. Tolterodine is also available without a brand name as a generic medicine. The muscle in the wall of the bladder is called the detrusor muscle. It can sometimes contract in uncontrollable spasms, and this is often referred to as having an overactive bladder. The overactive detrusor muscle can increase the number of times you need to pass urine or cause uncontrollable urges to pass urine or involuntary leakage of urine. Tolterodine works by relaxing the detrusor muscle in the wall of the bladder. It does this by blocking receptors called muscarinic or cholinergic receptors that are found on the surface of the muscle cells. This prevents a natural body chemical called acetylcholine from acting on these receptors. Normally when acetylcholine acts on these receptors, it causes the detrusor muscle to contract and the bladder to empty. So how do you take it? Detrusitol tablets are taken twice a day, morning and evening. However, follow the instructions given to you by your doctor regarding how many tablets to take and how often to take them. Try to take your tablets at the same time each day. This will help you to remember to take them. The tablets should be swallowed with a drink of water. They can be taken with food or without food. If you forget to take a dose, take it as soon as you remember, unless it is time for your next dose. In this case, leave out the missed dose and take your next dose as usual when it is due. Do not take a double dose to make up for an earlier missed dose. Detrusitol XL capsules are taken once a day. You try to take your capsule at the same time each day. Detrusitol XL capsules must be swallowed whole with a drink and not opened, crushed or chewed. They can be taken either with or without food. If you forget to take a dose, take it as soon as you remember, unless it is nearly time for your next dose. In this case, just leave out the missed dose and take your next dose as usual when it is due. Do not take, again, a double dose to make up for an earlier missed dose. So it may take a few weeks of taking this medicine before you see an improvement in your symptoms. It is important to keep taking the medicine regularly, even if you don't notice the benefit at first. Your doctor may want to see you after 2 to 3 months to check the medicine is working for you. Your doctor should reassess you on a regular basis to check if you still need to keep taking this medicine. So this medicine may make you sleepy or cause blurred vision, and so may reduce your ability to drive or operate machinery. So do not drive or operate machinery until you know how this medicine affects you. And it is not to be used in people who cannot completely empty their bladder or urinary retention, and also for people with closed angle glaucoma, also a condition called myasthenia gravis, which is where there's abnormal muscle weakness, people with severe inflammation of the bowel and back passage or ulcerative colitis, and people with a sudden expansion of the large intestine, seen in advanced ulcerative colitis or Crohn's disease. Also not to be used in pregnancy or breastfeeding. Detrusitol XL capsule contains sucrose and so are not suitable for people with rare hereditary problems of fructose intolerance, glucose galactulose malabsorption or sucrose isomaltose insufficiency. So for pregnancy and breastfeeding, there is no information available about the safety of this medicine during pregnancy. It is not recommended for use during pregnancy. It is not known if this medicine passes into breast milk. For this reason, it is not recommended for use by breastfeeding mothers. So the main side effects would be dry mouth, headache, dry eyes, blurred vision, constipation, indigestion, abdominal pain, excess gas in the stomach and intestines, vomiting and difficulty passing urine, dizziness or spinning sensation and pins and needles sensation, sleepiness, fatigue and dry skin. The side effects I have just mentioned may not include all the side effects reported by the medicine's manufacturer. For more information about any other possible risks or side effects, please read the information provided with the medicine or talk to your doctor or pharmacist. So how can this medicine affect other medicines? It is important to tell your doctor or pharmacist what medicines you are already taking, including those bought without a prescription and herbal medicines, before you start treatment with this medicine. Similarly, ask your doctor or pharmacist before taking any new medicines while taking this one, so that they can check that the combination is safe. The following medicines are not recommended for use in combination with Tolterodine, as they may increase the blood level of Tolterodine and increase the risk of its side effects. Macrolide antibiotics such as clarithromycin and erythromycin, the antifungals ketoconazole and itraconazole, and protease inhibitors for HIV infection, for example amprenavir or fosamprenavir. So if you have any questions, you can contact me through the live pharmacist on the website. You can email me or call into Lynch's Pharmacy in Cork. Thank you for watching and have a nice day.